Welcome to Module 3 of our anal cancer patient education. My name is Cheryl. I'm a nurse practitioner in the GI radiation oncology team here at MD Anderson. In this module, we will discuss the logistics of radiation therapy for anal cancer. Before radiation therapy starts, your radiation oncologist will order and review all necessary tests and studies to determine the cancer size, location, and stage. Then your radiation oncologist will schedule a treatment planning appointment called a simulation. The purpose of this visit is to position your body in the same position it will be in for radiation and to take a CT scan. Your radiation oncologist will use this CT scan to custom plan your radiation treatment for your individual anatomy. You will be asked to come for your simulation appointment with a comfortably full bladder. When the bladder is full, it helps to push loops of small bowel up and out of the pelvis. This can decrease the chances of some gastrointestinal side effects during and after radiation. The best way to do this is to empty your bladder 1 hour prior to the simulation. Then drink 16 to 20 ounces of water or other liquid over a 10-minute period. Then do not empty your bladder until after the simulation is over. The goal is to have your bladder full, but not to be uncomfortable. For anal cancer, the most common treatment position is with you laying on your back with your legs in a frog leg position. Your arms will be on your chest, holding on to an A-bar. You will be asked to undress from the waist down. The radiation therapist will respect your modesty by covering you with a sheet or towel whenever possible. During the simulation visit, your radiation oncologist and the radiation therapists will create a custom cradle or mold to keep your body in the same position for the planning CT scan. You will use this cradle for each of your daily radiation treatments to make sure that you are in the same position each day. We will place a small sticker on your anus, which will help us see it better on the CT scan. We will also take special precautions to protect the genitals from unnecessary radiation. For women, this means placing a cylinder in the vagina called a vaginal dilator. The purpose of this is to push the front wall of the vagina further away from the anal canal. By doing this, we can reduce some of the vaginal side effects of radiation. For men, this means creating a shelf and elevating the scrotum away from the anal area. We may also use paper tape to hold the penis out of the way. The purpose of doing this is to reduce side effects to the scrotum and penis. After the cradle is made and the genitals are protected, we will take a quick CT scan to make sure the spine and pelvis are straight. The radiation therapist may make some final adjustments to your position before taking the CT scan. Finally, a CT scan is done, focusing on the treatment area. The radiation oncologist will review the CT scan and make sure they have all of the information they need to start radiation planning. Once the radiation oncologist approves the CT scan, the radiation therapist will make some marks on your body with a marker to record your body's position and make it easier to set you up the same way when you return for radiation treatments. The marks will be protected with special clear tape, but you will be asked to protect these marks by avoiding submerging them in water, such as a bath, pool, or hot tub. Finally, the radiation therapist will give you 3 small but permanent tattoos on the pelvis. These are a total of 3 dots. They are on the left side, right side, and front of your pelvis to give us a permanent set of points to set up your treatments. These tattoos only take a few seconds to give, but do require a needle and permanent ink. This will be discussed with you prior to placing them. After the simulation appointment is complete, your radiation oncologist will start the work of planning and customizing your radiation treatments. They will undergo several rounds of safety checks and quality assurance. This typically takes about 5 business days after simulation. You will discuss your specific start date with your radiation oncologist at the time of simulation and can make requests. We will do our best to honor scheduling requests when we can. The staff in charge of operating the radiation machine each day are called radiation therapists. Before each treatment, remember to drink your 16 to 20 ounces of water or other liquid 1 hour before your appointment time, and do not empty your bladder until treatment is over. Arrive at the radiation check-in desk approximately 10 minutes prior to your scheduled appointment time. You will be directed to the waiting area closest to your radiation machine. When it is time for your appointment, you will be brought into the radiation treatment room. You will be asked to undress from the waist down, just like at simulation. Your therapist will help you lay down into the cradle that was made for you at simulation. Your therapist will position the vaginal dilator or scrotal shelf to protect your genitalia. Your therapist will keep you covered as much as possible to protect your modesty, as we recognize this is a sensitive area of the body to receive treatment. The therapist on the machine will take x-rays and/or a mini CT scan to make sure that your internal anatomy matches where it was at the time of treatment planning simulation. These images will be sent to your radiation oncologist to verify as well. The imaging and safety steps can take about 10 to 15 minutes. The radiation therapist will leave the room when it is time to start the treatment. There are cameras and microphones in the room, so the therapist can see and hear you at all times. The actual radiation treatment itself usually takes only 5 to 10 minutes, depending on your radiation plan. You may see and hear the radiation machine move around you, but you will not feel anything hurt, burn, or sting during treatment. Once your daily treatment is over, the radiation therapist will return to the room and help you get off the treatment machine table. You will then be free to get dressed and leave the department. You will have blood work drawn at the lab once per week. Both your medical oncologist and your radiation oncologist will review these numbers weekly and discuss the results with you. You will see your radiation oncologist once a week for a weekly C appointment. This usually takes 10 to 15 minutes and provides an opportunity to discuss any concerns, questions, or side effects that you may be experiencing. Your radiation oncologist will check your labs, check your skin, and give you any prescriptions you may need to treat any side effects you may be experiencing. For patients receiving cisplatin and fluorouracil chemotherapy, you will have 2 appointments at the infusion center each week. On Mondays, you will have your cisplatin infusion and your fluorouracil pump will be connected to your PICC line. On Fridays, your fluorouracil pump will be disconnected from your PICC line. Your medical oncologist will also meet with you at least once every other week. This concludes our module on radiation treatment logistics for anal cancer. Thank you for your attention.